The NHS is in trouble. We spend 200 billion, nearly 192, 200 billion pounds on the NHS. We spend like £3,200 each every year on the NHS. It's a mind-blowing amount of money. The money's a problem, but then, oh, hang on. What about NHS dentists? If we're spending £192 billion, there's got to be lots of NHS dentists, right? No, of course there aren't. Waiting lists that just go on forever and ever and ever. And this Labour government keep telling us they've sorted lots of them out, but you speak to anyone who's waiting for an appointment, it doesn't feel like they've sorted that out. The population's ageing. So obviously people who are older need more health support, right? That's just the way it is. So more and more people need the NHS. We've got a growing population. That's problematic because more people means more people who need healthcare. We've got mental health. And there's this thing that they say, oh, we're having parity of esteem between mental health and physical health, which doesn't mean anything. The people with recorded mental health need, the number of those people has gone up and up and up and up and up. Because we're much better at diagnosing and spotting and treating. But you know what? Everyone you treat, that's expensive. Because drugs are expensive. When you pay a prescription charge, if you pay a prescription charge, that does not cover the cost of the drugs. Not even close does that cover the cost of the drugs. And the better the NHS gets, the harder it is. So I nearly died of sepsis, right? I had a small cut, it got infected, I got sepsis. I was in the ICU for 7 days and I nearly died. I was unconscious for most of it, or for some of it. I was delirious. It was a lot. But the NHS saved my life. And now, because the NHS saved my life, I take all my head meds all the time like a good boy. And I take them all, and then the NHS gives me more, and I take them. And every time they give me more, it's costing them money. By saving my life, they have cost themselves loads of money. And this is just small fry. If people are reliant on wheelchairs or other access, whatever, if you save someone's life, you then need to look after them. One expenditure leads to another, leads to another, leads to another. It was never meant to be like this. When it was set up at the end of the Second World War to look after wounded soldiers, right? You would have seen like films and the movies or TV or something where you have kind of these long dormitories of normally men convalescing in bed, and then like some matron will turn up with a clipboard and have a look at them and all of this. And that was how it was. They didn't do much for mental health at that point. I think that if you were really struggling, you might be taken to an asylum. When it was set up, it wasn't set up for cancer. It wasn't set up for diabetes or asthma. And then as the National Health Service, it has grown and grown and grown, and treatments have become available that are really expensive, like really eye-watering, millions of pounds per machine. And you know what? You need to buy lots of machines because you can't just have one machine in London. You've got to have a machine where people are. It's expensive, it adds up. Again, we've got better diagnosis. The health landscape is totally and utterly alien from the health landscape when the NHS was set up. When you cut spending anywhere, the consequence of that are that people end up in the NHS. If you cut spending on housing and people are living in housing that isn't safe, that has mould, that has damp, the people in that home end up on the NHS. If you cut winter fuel payment, people who are used to getting that payment might consider not having the heating on or not eating to try and make things work. You know what? They can end up in the NHS. You cut police funding and you have more violence or more antisocial behaviour. Where does that lead? The NHS. Everywhere where there are gaps in funding, those gaps are then filled by the NHS because people get ill, physically, mentally, whatever. By putting endless money into the bucket, you're not solving the problem because it's coming from everywhere else. One of the biggest changes that's come in the last, 75 years is privatisation as a way of solving some of these problems, these ever-exploding expenditures, purchases, budgets. Tony Blair believed that the private sector could be more efficient. And the reason for that is that if you're just the NHS, it's quite easy to stick to maybe some of the procedures, some of the structures you've got in place, some of the workflows you've got in place. But if you're a company who is competing with another company, then you've got to be lean and tough. You've got to do it quicker and better and faster and cheaper than the other guy, or no one's going to buy your stuff. So Tony Blair was like, this is what we need. We need competition in the health industry. And he opened up lots of different ways to be competitive, to draw in private companies, including PFI deals where the company would build a hospital or schools and then we'd pay them back over time. Getting hospitals to work in the most effective way was the plan. And some people say it worked, some people say it didn't. But here's the thing. If you've got two private companies vying against each other, they are going to make money. And when they make money, it goes out the country. These are probably multinational companies, right? So it goes out the country. Whereas, when it's the NHS just working for itself, the money stays in the country and churns around through the NHS, pays wages, and all of these things. We like money sticking around. We don't like people making money out of our cancer care, right? That doesn't feel right. And some people are very, very anti all kinds of privatisation, and that's because they feel like it's a drip, drip, drip effect. And suddenly we'll have the whole hospital owned by private companies, and then things get a bit difficult. What can the government do about it? Well, first thing they could do about it, how about this? Here's an idea. They could just keep pumping more and more money in and not making it any better. Thing number two you could do is radical reform, which is what everyone says they're going to do, but no one's really done it. It's really difficult because the NHS is so big, moving things around. It's really, really, really hard. So, for example, Wes Streeting has said he's changing the way we book appointments to see our GPs, so to end that 8 a.m. scramble. That's probably, a good thing. Like, I think most people go, I don't like the 8 a.m. scramble. That's positive. They're using the app more, so you can be more involved with your own healthcare. And in fact, the app hasn't been updated that much recently, but more and more people are using it. These kind of reforms are there. They would say that's a starting point. They're going to move on. I think I agree with them. I just think it needs to be really just a really very vague starting point and then press on with reform, because we can't just keep putting the money in, so we need to reform things. And then there's the insurance model. And this is something you're not allowed to say in the UK because we love our NHS so much, and it needs to be free at the point of delivery. But there are people who talk about having some kind of health insurance where rather than you paying £3,000 flat in tax, we could choose a level of insurance that we want for ourselves, and then the insurance company pays out when we need healthcare. They say it doesn't work in America, and it really doesn't work in America. But there would need to be state-funded insurance for people who couldn't buy their own insurance and that kind of thing. It's not what the NHS was built for. It's not what the country wanted. But if you're going through options, you've got to bring that up too. And then finally, I want to bring up the most controversial, I think. And we've spoken about keeping status quo, we've talking about radical reform, we've talking about insurance, but maybe it's got to be a hybrid of all those things. Maybe we just have to expect less from the NHS. Maybe we find ways to just agree that it's going to be a less good service. You know, I don't know if that involves means testing the NHS. I mean, right now, the NHS will look after anyone if you're absolutely loaded. And that's kind of the point of it. It's a universal thing. But if we can't get real reform done and we accept that the choice of channeling more money in just isn't really viable, and we reject the insurance model outright, then we're only left with expecting less from the NHS.